everyone, my name is Shanaz and I welcome you all to my channel Nurses, the Heart of Healthcare. If you are new to my channel, please subscribe my channel, and if you like the content, if you find it helpful, then please do like and share my videos. Mathematics. Being a science student, we all think that we got rid of maths, and we studied, I think if I'm not wrong, we studied mathematics as an individual subject when we were in 10th last time, yes? But did we get rid of the maths? No, we cannot, because mathematics is one subject that is used broadly in many spheres of life, and it is used in nursing too, because they need to know how much fluid or how much medication they are giving to their patient based on their weight, age, gender and other factors. So maths is a very essential subject in nursing too, and being an essential part of the medicine and patient care, it becomes a prerequisite for the nurses to be perfect with the 4 basic arithmetic operations, that is addition, subtraction, multiplication and division of the large numbers. Every time when a medication is administered to a patient by any route, in any form, okay, or when we are doing a patient assessment, like when we are measuring the vital signs, when we are calculating the body surface area or the BMI, or calculating the burn area using rule of 9 or Parkland's formula, etc., etc., it is necessary for the nurses to know the basic mathematical concept so that they can do their job independently. Okay, so every nurse is expected to be very comfortable and familiar and perfect with the basic metric conversion so that they can do accurate drug dosage calculation. So the main theme of this video is drug dosage calculation. Let's begin. Drug dosage calculation, which is a very important aspect in nursing, okay, because inaccurate drug calculation, it can lead to overdose or improperly administered dose. Okay, either it is administered more or administered less. If it is administered more, it can be dangerous for the patient. If it is administered less, then we cannot get the effective result, okay, which is not good both for the patient as well as for the nurse. So that's the reason nurse should be familiar, and they should have a strong root in mathematics, okay, because remember guys, doctors are the one who are prescribing the medicine, patient's family is the one who are purchasing the medicine, pharmacist is the one who's dispensing the medicine, but nurse is the very important individual or very important healthcare professional who's administering the medicine. At last it is the nurse who's administering the medicine. So that's the reason they should check it properly, calculate it properly, prepare it properly, recheck it and administer it safely by following the 10 rights of medication administration. Okay, fine. So that was just a brief introduction about the drug dosage calculation. So let's start how we are going to calculate. First we'll see for the solid medications. Okay, so some medicines are available in solid form, some in liquid form. Okay, so solid medications are available in the form of tablets and capsules, yes, and the formula for calculating tablets or capsules dosages is required dose by stock dose is equal to the number of tablets to be given. Please memorize this formula, very simple it is. Okay, required dose by stock dose is equal to the number of tablets to be given. Okay, so what is required dose here? Required dose is nothing but the dose ordered by the physician or by the doctor. Okay, the dose advised, ordered or prescribed by the doctor is the required dose, whereas stock dose is the dose available in the hand. Okay, how much you have, stroke strength. Okay, so the strength which is available in your hand is stock dose, and the dose that is advised by the doctor is the required dose, will give you the number of tablets or capsules to be administered to a patient. Okay, now let us solve it. Let us do some examples so that we can understand it better. Okay, so it's very simple guys, you just memorize this formula. Okay, so let us solve the first example. Okay, here doctor advised to give cardiac loading doses for a patient with myocardial infarction in triage. Okay, and doctor advised to give tab ecosprin 325 mg, tab atorvastatin 80 mg, and tab brilinta 180 mg. Okay, so this is the cardiac loading dose advised by the doctor for a patient of myocardial infarction in a triage. Okay, so remember guys, these formulas should be memorized and understood by each and every nurse, and a number of times we have to do mental calculation. Okay, or it's all in the mind, we have to calculate. We will not get pen and paper every time to calculate it, will not have that much time. Okay, so we need to be perfect and we have to be fast in the calculations. Okay, and but this is a simple one. So what is the formula? Required dose by stock dose is equal to number of the tablets to be given. Okay, the first drug cardiac loading dose is ecosprin 325 mg, and the stock dose is also 325 mg. Order dose 325 mg, stock dose 325 mg. So nothing to calculate, same tablet, one tablet we have to give. Whereas tab atorvastatin, it is ordered 80 mg, and stock dose what we have is 40 mg. Okay, so we have 40 mg in hand and ordered dose is 80 mg. So when we put this in the formula, required dose by stock dose, so 80 divided by 40. Okay, when you cancel this 0 out, 4 2s are 8, so it is 2 tablets. 80 divided by 40, so we have to give 2 tablets of atorvastatin to get 80 mg. Okay, then ecosprin is antiplatelet guys, and atorvastatin is a statin, right? It's a statin, it lowers the bad cholesterol in the blood. Then tab brilinta 180 mg is ordered, so required dose is 180 mg, and stock dose what we have in our hand is 90 mg. Okay, so when we put this in the formula values, we'll get 180 divided by 90. Okay, so this 0 and 0, when we cancel it out, 9 2s are 18, so we'll get 2 tablets. So we have to administer 2 tablets of brilinta to make it 180 mg. Okay, so how we are going to give it all together? Cardiac loading doses: ecosprin 325 mg 1 tab, atorvastatin 80 mg, we have 40 mg in hand, so 2 tablets will give, and brilinta 180 mg, so we have 90 mg in hand, we are going to give 2 tablets. Okay, so this is how we are going to calculate and administer. It was very simple, right? Okay, let us do one more example. Doctor advised or doctor ordered tab calcium carbonate 1500 mg for a patient, and the drug is available in 250 mg tablets. How many tablets should be given to the patient? Calcium carbonate, we know that it's a calcium supplement, it is an antacid too, and it is also a phosphate binder. Okay, so first we can do one thing. What we can do is, we can underline each and everything what we want. First of all, what drug we are talking about? Calcium carbonate. It is a calcium supplement, antacid, and a phosphate binder. Okay, so what is the dose ordered? 1500 mg is the dose ordered, and what is the dose we have in hand? 250 mg each tablet. Okay, so required dose is 1500 mg, stock dose is 250 mg. Okay, so required dose by stock dose 1500 divided by 250. So when you divide it, okay, you can cancel this 0 out, 1 then 25 6 are 150. Okay, so we get 6 tablets. So 6 tablets of calcium carbonate we have to administer to the patient to get the dose of 1500 mg. Okay, so this is how we'll calculate. Let us do one more example. Doctor advised tablet haloperidol. Okay, haloperidol is given for a patient with hallucinations. Yes, it's a antipsychotic medicine. It is available, the available dose is 5 mg tablets each, and how many tablets we have to give? Okay, so what is the medicine that we are talking about? Haloperidol. Okay, it is an antipsychotic, and what is the dose ordered? 2.5 mg, and what is the dose available? 5 mg. Now let us put that in formula. Okay, required dose by stock dose 2.5 by 5. So when we divide it, okay, I think you all know this, right? How to divide the decimals. Okay, division of decimals. Then when we divide it, we'll get 0.5. 0.5 means it is half tablet. 1 tablet is 1 full tablet. If you 0.5 means it is half tablet. So half tablet of haloperidol should be given to the patient to get 2.5 mg. So this is how we are going to calculate when we have solid medications, that is tablets or capsules. Required dose by stock dose is equal to number of tablets to be given. Okay, then some medicines are available in liquid form. Yes, okay, some medicines are available in liquid form. Okay, and it can be syrups or suspensions or solution. And liquid medicines are commonly advised for which patient? For those patients who have difficulty in swallowing. Okay, who have difficulty in swallowing the tablets or capsules, or those who are on on nasogastric tubes. Yes, or on those who are intubated patients. So for them liquid medicines are advised, such as syrups or suspensions or solutions. Even tablets, they are crushed and they can be given. Okay, fine. So let us see some examples. For liquid medicine, how will we calculate? Only thing is we have to know tablespoon and teaspoon. Okay, 1 tablespoon is 15 ml and 1 teaspoon is equal to 5 ml. This we have to remember, guys. Okay, 1 tablespoon is equal to 15 ml and 1 teaspoon is equal to 5 ml. Okay, now see here. Doctor advised to give 3 tablespoons of lactulose for a patient with chronic constipation. How much will you administer? So first of all, we should know about what medicine we are talking. It is about lactulose. Lactulose is it is a laxative agent. Yes, it is used to treat constipation, as well as it is used in patient with hepatic encephalopathy. Yes, okay. So doctor advised how much? 3 tablespoons. 3 tablespoons. 1 tablespoon is equal to 15 ml. So 3 tablespoons is equal to 3 into 15, it is 45 ml. So we have to give 45 ml of lactulose solution to the patient. Okay, simple, right? Yes, let us see one more example. Doctor advised syrup ascoril plus 2 teaspoons for a patient with productive cough. How much will you administer? So which drug we are talking about? Which medicine? Syrup ascoril plus. Syrup ascoril, it is expectorant, yes, which is given for the patient with bronchitis and other respiratory problems and to treat the productive cough. Okay, so 1 teaspoon is equal to 5 ml, and here how much they have ordered? 2 teaspoons. Okay, so 1 teaspoon is 5 ml, 2 teaspoons is equal to 2 into 5, that is 10 ml. So we have to give 10 ml of ascoril plus to the patient. Okay, let us see one more example. Doctor advised syrup cetirizine half teaspoon twice daily for a 2-year-old child. How much will you administer? Cetirizine hydrochloride, we know that it is used for, yes, it is used in allergies, right? Like allergic rhinitis and all that. Yes, cold. So cetirizine is advised. Okay, half teaspoon. So how much? 1 teaspoon is equal to 5 ml. So half teaspoon is equal to 5 by 2. 5 divided by 2. When you divide 5 by 2, you will get 2.5 ml. Okay, so we have to administer 2.5 ml twice daily. See, when the syrups and suspensions, when they will be usually mentioned in tablespoon or teaspoon, but will not have tablespoon and teaspoon every time available in the hand. Usually along with the syrup bottle, we'll get one small plastic cap which will have the measurements on it. Okay, 2 ml, 5 ml, 10 ml. Okay, so we should convert this tablespoon and teaspoon into ml so that we can administer it properly. So accurate dose is very important to get accurate results. Okay, and for patient safety as well as for the nurse safety. Okay, next, this was how to calculate for tablets, capsules and for the syrups. Now let us see how we'll calculate the drug dosage calculation for the liquid medicines. Okay, see, some medicines that we are administering through intramuscularly or intravenously or subcutaneous, okay, through apart from the oral, other routes. Okay, some are available in liquid form, okay, or mixture or as a solution. Okay, even if it is available in a powder form, we are not going to administer powder to the patient, right? So we'll dilute it first with the NS or the sterile water, and then we will give it to the patient. So what is the formula and how to calculate it? Let us see. The formula is very simple. It is required dose by stock dose into stock volume is equal to the volume to be given. Okay, this is called the universal formula or the basic formula. Okay, there are different methods to do the drug calculation, and this is desired over have method. Okay, this method name is desired over have method, and this is universal formula. D by H into Q is equal to amount to be given. What is D? D is desired or the ordered dose, and H is the dose in hand, and Q or V is equal to stock volume or the quantity of the drug. Okay, so what is the formula? Required dose by stock dose into stock volume. Okay, so please remember this. Now using this formula we are going to calculate our dosages. Okay, so and always remember that when we are calculating, the unit should be same. Okay, the units of required dose and stock dose should be same. If the required dose is in mg, the units of stock dose should also be in mg. If the required dose is in grams, the units of stock dose should also be in gram. If one is in mg and the other one is in gram, then we have to convert it first and then solve it and then apply it in the formula. Okay, so the units of both required and stock dose must be same, otherwise we will not be getting accurate results. Okay, so let us see the first example. Doctor advised to give 8 mg Zofer for a patient with multiple episodes of vomitings. The drug is available as 4 mg per 2 ml. How many ml should you administer? Okay, so first of all we should know about what medicine we are talking. So here we are talking about Zofer. Zofer is an anti-emetic. Yes. Okay, and how much is the dose ordered? Dose ordered is 8 mg. Okay, and how much is the dose that we have? 4 mg 2 ml. It is available in the ampule form. Okay, 2 ml ampules are available, and each ampule is 4 mg. Okay, so what is the formula? D by H into Q is equal to volume to be given. So how much is the desired dose? 8 mg. How much is the stock dose? 4 mg. And what is the volume? I mean quantity of the drug or the stock volume? 2 ml. Okay, so when we put all that in formula, 8 mg by 4 mg. See here please, both the units are same. Okay, required dose and stock dose, both the units are same, then it is easy to calculate. If they are different, then you have to convert it first. Okay, metric conversion you have to follow. Okay, so when you divide, these units will get cancelled. Yes, mg, and then when you divide 8 by 4, 4 2s are 8. Okay, so you will get 2 into 2, that is 4 ml. So we have to administer 4 ml of Zofer to the patient as ordered. Okay, 4 ml is equal to 8 mg, 2 ml is equal to 4 mg. So this is how we are going to calculate. And remember guys, every time when we have to do this calculation, it has to be done mentally. Yes, mental calculation, and the time you have is the doctor advised it and you are walking towards the medication counter or the medication cupboard. Just you have to do it in the mind, how much you have to before starting preparing it. Okay, before loading it. Fine, so you have to do it mentally. Each and every time we'll not have paper and pencil in our hand to calculate, and we'll not have that much time also. Okay, so we have to do mental calculation and we should be very fast at doing it. Okay, and accurately too. Let's see one more example. Doctor advised to give 400 mg of hydrocortisone for a patient with allergic reaction. Drug is available as 100 mg per ml in a powder form. How many ml will you administer? So first of all we should know what medicine we are talking about. That is hydrocortisone. Hydrocortisone is nothing but it's a corticosteroid. Yes, which is used in allergic conditions. Yes, to treat allergic conditions and many other things. Then what is the ordered dose? 400 mg. What is the stock dose? 100 mg. What is the stock volume? Per ml. Okay, so 100 mg per ml. So what is the formula? D by H into Q. So how much is the desired dose? 400 mg. How much is the stock dose? 100 mg. And what is the volume? Stock volume 1 ml. Okay, so when you divide it, these units will get cancelled. See, both are mg. These units will get cancelled. So 100 divided by 4 will be 4. So 4 into 1. So it is 4 ml. So we have to administer 4 ml of hydrocortisone to the patient. Hydrocortisone is available in a vial form. It is in a powdered form. We have to dilute it with 5 ml NS or sterile water. Then each ml will contain 100 mg. Okay. So 4 ml 400 mg, 5 ml 500 mg, 2 ml 200 mg. Okay, it's very simple. Fine. Then let us see the next one. Doctor advised to give injection atropine 1 mg IV to a patient with bradyarrhythmias. Drug is available as 0.6 mg per ml ampule. How many ml will you administer? So first see which medicine we are talking about. Atropine. And atropine is a an anticholinergic agent which is used in bradyarrhythmias. Yes. Okay. And the ordered dose is 1 mg. Yes. And available dose is 0.6 mg. And stock volume is 1 ml. Okay. So first these are the important things that we have to note in the question. Okay. And then we can calculate it easily. And so what is the universal formula that we are using? That is D by H into Q. Okay. Desired dose by dose in hand into stock volume. So desired dose is 1 mg, stock dose is 0.6 mg and stock volume is 1 ml. So that mg gets cancelled, and 1 when we divide it by 0.6 is about 60% of the medicine, right? So it is 1.6 ml. 1.6 ml of medicine we have to administer. 1.6 ml of atropine we have to administer. Next, let us see how to find the concentration of a drug. Okay, to find the concentration of a drug, the formula is weight by volume. Very simple, weight by volume. And to get both this from the question, you have to only consider the stock dose. Okay, not the ordered dose, only the stock dose for weight as well as for the volume. Stock dose only you will consider. Okay, let us see. Injection lorazepam 2 mg is ordered. It is supplied 4 mg per 2 ml. What is the concentration? So yes, when we get a patient who's having seizures, yes, or the patient is not cooperating for a MRI or CT, or yes, making the procedures difficult, then that time the doctor will order loraz. Yes, so 2 mg loraz is ordered here. So loraz in an ampule form we get 4 mg 2 ml. So let us find the concentration, weight by volume. 2 mg is the ordered dose. We don't have to see this. We have to see only the stock dose. Stock dose it is, weight is 4 mg, volume is 2 ml. So weight by volume, 4 divided by 2, it is 2 mg per ml. So what is the concentration of the loraz here? 2 mg per 1 ml. 4 mg, 2 ml. Okay. Okay, let's see one more example. Injection fentanyl. 50 mg is ordered. Okay, for a patient in severe pain, and it is supplied as 100 mg per 2 ml. So what is the concentration? The formula is weight by volume. Okay, so what is the drug we are talking about? Fentanyl. It is an opioid analgesic. As we know, it's a narcotic. Okay, this is ordered dose. We don't have to see this. To find the concentration, we need only weight and volume of the stock. Okay, so what is the weight of the stock? 100 mg. And what is the volume? 2 ml. So weight divided by volume, that is 100 divided by 2. So when you divide 100 by 2, we'll get 50. So 50 mg per 1 ml. Okay, so it is 25 mg per 0.5 ml, 50 mg per ml, 75 mg for 1.5 ml, and 100 mg for 2 ml. Okay, so simple, right? So we just have to memorize the formula, and when a question is given in the exam, or when we have to solve it practically in our area, then we have to do it smartly and fast and accurate. Okay, so hope this helped. So guys, if you find it helpful, if you find the content helpful and for easy to understand, then please do like and share my videos, and do subscribe my channel. Keep learning, keep growing. If you stop learning, we'll stop growing. Okay, so and stay connected with Nurses, the Heart of Healthcare. Happy to help. Thank you. Have a good day.